Hello, this is Dr. Arpan Chakraborty from Kolkata. I do practice critical care and ECMO, that is extracorporeal membrane oxygenation, for almost last 15 years. And we have been as a team in different hospitals. We have provided ECMO services during COVID, even in non-COVID patients, and with a considerable success rate. Now it is a time for ECMO to penetrate every corner of the society, because as we know, the ECMO was earlier considered to be an acute therapy for some acute cardiopulmonary failure patients. But as the time is going on and with the rising success of ECMO over the years, it has pushed us to use this novel technology in different chronic conditions also, like in chronic heart failure, respiratory failure, RV failure. And we are getting success even in those cases. It has penetrated well into the pediatric patients, pediatric pneumonias, neonatal respiratory failure with a considerable success. Now it is coming in a bigger way to the respiratory critical care to use in the chronic respiratory patients whom we didn't even consider 5 years back as an ECMO candidate. A part of ECMO therapy known as extracorporeal CO2 removal, which is being successfully used in ARDS to put them on the lung protective strategy of ventilation with the permissible hypercapnia. This therapy is now successfully getting used in the COPD patients with a proper type 2 respiratory failure whom we don't want to intubate or don't want to put him on ventilator, or we want to early extubate, just taking the CO2 part out by this extracorporeal means. So we need to educate people at every level the use of extracorporeal therapy, even in poisoning, even in drowning, even in all kind of heart failures, all kind of respiratory failures, whichever looks irreversible at some point of time, but it can be reversed with a prolonged therapy, and that can be reversed. We need to reach this with the technology to those patients, to the clinicians also, who are not considering this therapy as a part of their management whenever they are in trouble. It is a time to educate them also. So this ECMO physician concept, people who are using ECMO or practicing ECMO for almost 5 years, they have to consider this ECMO awareness program to every level of the society to give this a stand to this kind of therapy so that it can help the mankind. ECMO physician, be ECMO physician and propagate the ECMO awareness to the society. Thank you.